and young adults require a different approach to care because they have unique medical, social, emotional, and developmental needs. Dr. Lisa Lowery, the section chief of the Adolescent Medicine Program at Spectrum Health, is here to talk about empowering adolescents to make good health choices for themselves. Welcome.
Thank you. Thanks for having me.
I like where we're kind of kicking off here, really empowering young people to have a stake in their own health. It makes sense.
It is. Adolescence is often known as a time of strife and turmoil, and honestly, most of us wouldn't want to be teenagers again. But most of the time, they go through adolescence and teenagerhood, as we sometimes call it, unscathed. They're very resilient.
Yeah, and I think a lot of young people are often struggling for control and understanding, and so maybe we can help them out when it comes to this. So let's talk about some of the things that are treated, through the hospital. What is offered?
So in our program, we provide primary care mainly, but we also are a subspecialty multidisciplinary clinic. So we carry and cover things from eating disorders, anxiety and depression, a lot of reproductive health issues, behavioral issues, school concerns, and then also that transition into adulthood.
That's interesting because those are a lot of things, of course, I think as parents who may be watching, saying, it is a tough road sometimes to navigate, but these things happen, and you have a team, not just a few, a team of experts that can really help in all areas.
Yes, we have a multidisciplinary team, and I think what's unique about our practice is that we are not uncomfortable asking those uncomfortable questions. So we provide a affirming, positive, safe environment so that we can ask those sometimes scary questions and deal with those issues that sometimes our teenagers and young adults face.
Yeah, and Dr. Lowery, I just have to ask you, for a parent or a loved one or a family member who's watching and thinking, I didn't think that this is something that I would go to Spectrum Health for. This is something that we kind of have to go on it by ourselves. That is not always the case.
That is not always the case, and again, we have a unique environment, and there are hundreds of pediatricians and family practice doctors in the area that refer to us, and we walk beside them and support them. And then when there are unique instances, those tough patients, we are there as a resource. Again, we also provide primary care for our young people. We have a multidisciplinary team, which includes a social worker too.
Yeah. So let's get back to what we mentioned up front, involving adolescents and young people in their health care. Why is it important that we do that?
Well, it is important for them to develop tools to be able to transition into adulthood. And that's our ultimate goal, for them to go from childhood to adulthood. So working with them, developing their self-autonomy, their self-esteem, their resilience, and just the ability to be able to interact with the healthcare team is all important.
And healthcare can be engaging as well.
It can be engaging and fun. And I think one of the most exciting times of the job is when that teenager or that young adult has that aha moment and gets it and saying, I'll be okay, I'm going through a tough time, or I'll just be able to survive high school and go into my career or college.
Yeah. So what is an indicator, or what should a person think about in knowing if they need to seek the help of a professional, an expert, a doctor? Are there certain signs, or is this a certain point where say, this isn't just growing pains that our family is experiencing, we need a little bit more help and expertise to kind of walk with us through this journey?
Well, that's one thing you can contact our office for. There's no dumb question, there's no scary question for us, but anytime you're feeling like overwhelmed, unsure of the resources in the area, we're greatly connected to a lot of community resources, as well as our subspecialists at the Children's Hospital. And our unique situation, we're also the medical home for our juvenile justice Kent County Juvenile Detention Center, as well as various agencies like DA Blodgett, St. John's Home, Bethany. So we deal with a lot of community resources, or just can help tap that parent into those community resources.
Do you think a lot of people don't realize that this exists at Spectrum Health? Because I know that was one of the reasons we wanted to speak with you and bring a little light to the issue, is to know that there is this area, and you being the chief of it, I mean, it's well established and it's there if needed.
Yes, adolescent medicine Our program has been around for over 20 years. And I think a lot of people don't know we exist, and unfortunately one of the best kept secrets. And so we're out there, we're willing to help you with your unique problems, tough issues, however we can help our young people.
Well, we're helping to get the secret out because we have information about how that everybody who's watching, if they need to, can connect with you. And we'll also put it online in case people have some questions or need additional information, or perhaps just getting connected with a program to help with any need they may have. We really appreciate you, Dr. Lowery, coming on and discussing this with us.
Thank you.
We have much more 8WEST coming up, so don't go away. We'll be right back.